This morning's number is 2,028. That's the number of COVID deaths in the U.S. just yesterday, according to the COVID Tracking Project. It's the highest number of deaths in the U.S. in more than 6 months. Data elsewhere is no better. More than 80,000 people in the U.S. are hospitalized with the coronavirus. That's a new record. And public health officials fear it could get even worse as millions of Americans ignore the advice of public health experts and travel for the Thanksgiving holiday. 3 million people went through U.S. airport checkpoints between Friday and Sunday. That's the biggest crowd since mid-March, when the U.S. was at the beginning of the pandemic. Joining me now is senior scholar with the Hopkins Center for Health Security, Dr. Amish Adalja, joining us live from Pittsburgh. Dr. Adalja, what would you say to people who are traveling for the Thanksgiving holiday?
I would say that this is going to be something where we're going to see spread inevitably, and we're already seeing all of the safety measures that airports have put into place kind of be flaunted, even at gates. So this is going to be a risk factor for contracting the disease, spreading the disease, not only with the conveyance of the travel at the airport, but also when you get to the place you're going to, because what we'll see is mixing of one household with another household. And we know that there are parts of this country where there are high levels of infection, and what's going to happen is you'll see chains of transmission get set off at Thanksgiving dinners that will then eventually land on vulnerable populations and then continue to stress our hospitals. So in general, when you're doing Thanksgiving, it doesn't mean you don't have to do it. It's just there's some common sense things to do. And I think that mixing households is something that you really don't want to do in this setting.
Yeah, I mean, I'm worried that we're going to see inevitably, just in 2 or 3 weeks right now, stories from people who say that they regretted their Thanksgiving travel and trying to provide warning for people for the Christmas holiday. Given the number of people who are traveling this week, Dr. Adalja, the data that we're seeing, how bad do you think things can get in the next couple of weeks, given that we're at record hospitalizations right now and the spread is continuing in pretty much every state?
Sorry, I lost you.
I'm saying, given the what we're seeing right now in hospitals, the record number of people hospitalized and the spread that we're seeing, and that people are traveling, how bad are things going to get in a couple of weeks when people return home and spread it to their communities too?
It's hard to predict, but you can see that people's activities are not really changing, that people are not heeding advice. And there's going to be inevitable transmissions, as I said, that happen at Thanksgiving. We saw this during the Canadian Thanksgiving about a month ago, where there was an upsurge in cases. And what we know right now is that many hospitals around the country are already stressed, already worrying about their capacity, thinking about alternative care sites, thinking about staffing and personal protective equipment. That is only going to get worse as we see the results of Thanksgiving. And I think that's why it's important to just follow the common sense recommendations from public health.
Dr. Adalja, you're the lead author on a new report about the lessons that healthcare professionals learned from New York City in the surge in the spring. One of the takeaways is that clinicians need more information about the available resources in these crisis scenarios. What information are you talking about here, and how do you see that benefiting the decision-making that clinicians do?
So what we did in this report is talk to individuals that were in New York City, the intensive care unit doctors that were really stressed during March, and really try to understand what happened there. And we have this concept called crisis standards of care, and that's when you're not able to deliver the normal standards of care. And what we saw was that many of those New York hospitals were actually in crisis standards of care, the way that you would have been in, for example, during Hurricane Katrina. But there was never any kind of bell rung or no switch that got thrown. It was kind of this transition that happened where they knew that they were not necessarily doing everything the way that you would in a normal day. And the resources that we need to know about are, what are the other hospitals in the area? What is their capacity? Can we facilitate transfers? How many ventilators do we have? How many ICU beds? What are the standards we're going to use when we don't put people on ventilators that might not necessarily benefit from them? How do we make that transition, and how do we make it very visible to everybody that's working so that they know that this isn't just a busy Saturday night, but this is now a new normal. And that's really something that I think has been neglected in pandemic planning, is thinking about what happens in our resource limited areas, which could be ICUs in major cities. And I think that this really was a galvanizing moment to try and get this right, and to try to make crisis standards of care something that are really valued by hospitals and implemented by hospitals and integrated with workflow. Because right now we're seeing the same thing happen in other places, in Iowa, in Utah, in North and South Dakota, in El Paso. And we need to learn from these lessons and really get much better at delivering care, even when we're in in a stressed environment. And crisis standards of care give people a framework to be able to think about these problems.
What about when it comes to the psychological health of the healthcare providers? Because the report discusses the psychological toll that it's taking on healthcare workers, especially for those clinicians who are making life and death decisions. What types of support are clinicians given right now, and how has that changed since the pandemic began months ago?
This is increasingly being recognized as a major problem because many of us have been taking care of COVID patients since March without any break, and it's kind of the same thing over and over again. And there's a lot of stress, and I can remember back in March how hard it was to get a test and yelling and screaming with trying to get people tested. But that's still continuing, and it does take a toll. I've been practicing in a place that's not a major epicenter, but I know people that are practicing in New York, and I do think that this is going to really scar them. And talking to people there, you can almost see that they have that they're triggered just talking about some of the experiences that happened in the spring. So this is something we have to take seriously. Hospitals are making programs. There are professional societies like the Infectious Disease Society of America, the Society for Critical Care Medicine, that are making programs to try and help with the mental health of clinicians, because we've been going at it since the very beginning. And I think that's an important message to the public. When you take irresponsible actions when it comes to COVID-19, when you don't follow our guidelines, it's you're not just affecting yourself and whoever you infected, you're also affecting us, the doctors that are taking care of you in the hospital and your community hospital. So this is an important aspect of this, that everybody's actions have all of these cascading impacts on the healthcare system, including on the mental health of the doctors that have to take care of you.
Senior scholar with the Hopkins Center for Health Security, Dr. Amish Adalja, joining us live from Pittsburgh. Thanks for your time as always, Dr. Adalja. And we should note that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.